Hi, Richard Williamson. I'm here to have all on four uppers and lowers done today. So I'm pretty excited to get it done. The main reason that brought me here is that I do have underlying medical conditions, and so I'm constantly getting infections in my mouth and everything, and it's really not good. And my recent visit to my regular dentist, I need to have some root canals, I need to have additional bridge work done, many things. So they referred me over here because they thought that this might be a better option for me.
Just like Mr. Williamson, you don't need multiple implants. So the quotes he was getting add to the cost, add to the time, sometimes, doing grafting. Well, in his case, he was able to do that without all of those things and save himself some money. And it's actually an honor to have him as a patient. I think he was one that could show that, you can do many, many implants, or you can do what we did and have the warranty behind it. So if there's a problem, it's my problem, not your problem.
So after talking with Dr. Johnson, I think this is the best thing for me because I'll be able then to have a regular set of teeth that will actually work at up to 90-95% of the bite that I had with regular teeth. And actually it'll be better because I'm constantly walking around thinking I'm gonna bite into something and break a tooth, or I'm gonna get something under my gum line and I'm gonna get an infection, and then I have to go on antibiotics. And it's that vicious cycle of taking care of your mouth and doing all that. So I'm really excited about having this done. A little anxious though, must admit, but I think I'm in good hands, and I'm really looking forward to it. I did not meet with anybody else. I did a lot of research online when it came up, when my dentist called me and said he wanted to refer. So I wanted to look at options before I met with anybody. So when I met with Dr. Johnson, I kind of was listening to him because I had an understanding of what he was talking about. And so he was making me feel very comfortable because he was confirming things that I had heard already, that I had researched. So it was kind of falling in place, like, I think this guy knows what he's doing. And it made me very comfortable. So then, to be honest with you, it was like the cost. How much does this cost, right? But when I looked at the price of what they wanted to do all the dental work I need done, it was going to cost me probably almost half of what I'm paying for this. And then I'm going to have to return to keep continually fixing things and paying for more and more. And I looked at how much money have I been paying over all the years. I mean, I could have had this done 2 or 3 times at the cost, to be honest with you. I mean, you got to look at everything. So the big picture to me was, as long as I'm with somebody who's reputable, that has a good history, which he does, then I'm confident to do this and comfortable to do it. So like we were talking about before I went in and had the procedure in the morning, the biggest problem I had at that point was I had so much anxiety. I was really worried about being put under and, basically even waking back up. I'm a chicken when it comes to that stuff. But the process went really well. Everybody in the room they were so professional, and they were so active. Even if you had anxiety, it was busy. It took your mind off things. And next thing I know, I was out. And then the next thing I know, I was wide awake and getting new teeth put in. The process was very simple as far as I was concerned. I did have a little bit more bleeding, but that's because of my underlying health issues. I bled a little bit more than I think might have been normal. But they're professional. They knew exactly what to do. Everything was taken care of. They got the new temporaries, which I've got in now, these beautiful temporaries. And I went home. And I was tired by the time I got home because it was a long day. It's basically a long day. And, but I didn't really have much pain, discomfort. I went to sleep, got up the next day, other than having bruising and some swelling. But I took the pain pills that they gave me, the ibuprofen and everything. And I also took penicillin to make sure I'm not getting any infections, which is good for me. And I really didn't have much pain at all. It was more just your discomfort, you know, because you've got like something in your mouth that hasn't been there before, so it kind of feels a little funny. My tongue doesn't really know where to go at first. And I must be honest, I think I'm sounding better, but at first I had trouble talking. You know, it was like, and I love to talk, let me tell you. But talking, and I didn't really do anything with them the first day, but then I started taking care of them. You know, you have to start brushing them, and eventually they told me to start using the water pick and on the lowest setting, so to keep them clean. I'm still doing a liquid diet, very soft, because, you know, this is a process and it's expensive. I don't want to break it. I want to make sure everything has time to settle and bond and do everything it's supposed to. I'm in no rush to bite into an apple to prove that these things work, okay? They look nice. I'm happy with them. I don't want to break them until they get all fixed, you know, settled in there. And then, of course, by the time I do that, you'll just take them out and give me my permanent ones, which are supposed to even be nicer, but I don't really know. Everybody who's seen these say they look so nice and natural. And like I say, I'm not having any pain anymore. I stopped taking any Tylenol or ibuprofen or anything. I'm not doing any of that. So I'm just maintaining them and sticking with a liquid diet. This is my first day back to see the doc. It's basically just it's just a process. You know, taking it one day every day I got better and better. I felt better, stronger. I went back to work the next day because I work online, so there wasn't any pain or anything where I couldn't concentrate on my work or anything. It's just more the eating and doing all of that stuff, getting used to stuff. But I'm really happy about it. I think it's worked out really well. I'm glad I did it.